welcome to The Doctor is In. I'm Dr. Freddie Gomez. The goal of this program is to answer your medical questions during this time of COVID-19. Of course, we want to make the most out of your telemedicine appointment today, so please send in your questions and we'll do our best to answer them. Now, COVID-19 infects our immune system through the respiratory system. And among other parts of the body, it attacks the lungs. That's also
suffer from tuberculosis, and this disease claims the lives of over 70 people every day. While most medical services are focused on addressing COVID-19, ensuring essential health services for TB patients should be maintained as well. Now, joining us in this discussion is Dr. Jubert Benedicto, the Pulmonary and Critical Care Specialist and past chairman of the Philippine Coalition Against Tuberculosis. Welcome to the program, Dr. Benedicto.
Yes, good afternoon, Freddie, and good afternoon to all your viewers.
Doctor, what are the similarities of COVID-19 and tuberculosis?
Yeah, well, first of all, as what you've mentioned, both of them tends to affect the respiratory system. Both of them are droplet infection, so that means they are being spread mainly through coughing, and therefore, any protective gears can possibly deter their spread as well. Both of them, of course, will affect the lungs and will manifest as cough and other associated symptoms. And basically, they tend to affect they tend to affect severely those who are at the extremes of age, those who are relatively young and those who are old.
Now, considering that both mainly affect the lungs, how can you tell that it's TB and not COVID-19?
Very good question, especially since, as what you've mentioned, the Philippines is quite prevalent as far as TB is concerned. So mainly, when we think it's COVID-19, it's usually cough associated with other symptoms, and the cough tends to be acute. That means the cough is relatively less than a week old, and in a lot of instances is associated with difficulty of breathing, especially in the more severe cases. And most of the time, it tends to be non-productive. So mainly patients will tend to complain that it's cough, which is relatively dry, and which is associated with itchy throat, or let's say some throat pain. Unlike, let's say, tuberculosis, where majority of the time, for TB, cough tends to be chronic, which means it's at least 2 months in duration, and it tends to have, let's say, low-grade fever, unlike, let's say, for COVID, wherein the fever is relatively high or moderate grade. For TB, it tends to be low-grade, and of course, for TB, there tends to be other systemic manifestations, like, for example, loss of appetite, or let's say, failure to gain weight, or even loss of weight, which we do not see for COVID-19.
Now let's answer some social media questions that the viewers have been sending in. We have one from Rap Ramirez. Ang tanong niya is, do COVID-19 and TB spread the same way?
Yes, they do. So it's mainly droplet infection, and therefore, in a lot of instances, for both of these respiratory illnesses, we would like to, of course, advise the patient proper cough etiquette. So that means cover your mouth when you do cough. If there's a tissue paper, if it's quite productive, you can spit there and then throw it, or subsequently you can throw sa toilet bowl and then flush it. So they tend to spread in the same manner. So in the same manner as well, we would like to say that, of course, masks tend to be deterrent in terms of its spread. So lalo na yung mga afflicted individuals, we would like to advise them to have a mask so that it will tend not to spread the infection.
We have another question from John. Tanong niya, once infected, when do symptoms of TB start manifesting?
For TB, it tends to be, hindi mo siya mararamdaman kaagad eh. So it tends to, really just creep in subtly. So majority of the time, the patient tends to be well. Tapos in a lot of instances, when they now begin to appreciate that the cough does not go away, they have the x-rays and other examinations, boom, the clinician thinks it's TB. So for tuberculosis, it tends to be roughly from the time that you get the TB bacilli to the time that, let's say, manifestation sets in. It's usually a month, or let's say a month or two before you know it really symptom tends to set in. But having said that, in let's say 25% of cases, TB can be totally asymptomatic. So that means na they discover na lang naming clinician when you do routine x-rays and the like. So that's for tuberculosis.
Okay, and we have our third question from Maricel. Do children get tuberculosis easier than adults?
I would like to say yes, they tend to get TB easier because probably of the not so developed immune system compared to adults. And as what we have seen, even let's say few TB bacilli entering the kid's body, if the child is unable to contain the TB bacilli tends to spread beyond the pulmonary system, so beyond the lungs. So this is what we term extrapulmonary TB. So sa mga bata, yun yung may mga kulane or lymph node, especially sa leeg, or sometimes they tend to lodge in other parts of the body like TB of the bones, etc. So really, children tends to be more affected, and even extreme age yung older adults as far as TB is concerned.
That's right. And we will continue to answer your social media questions later on in the show. After the break, we will discuss how to prevent TB infection in this time of COVID-19. Stay tuned to The Doctor Is In. You're watching CNN Philippines.
Amid the darkness, look on the bright side. Frontline medical workers are at bigger risk of catching COVID-19. But this nursing assistant at a hospital in Taguig City won't let the disease get him down. And Nico Torreon wants to share only good vibes on social media. This was also Torreon's way to let his family know he's alive and kicking. He's also appealing to everyone to follow the quarantine guidelines.
Magtulungan tayong lahat at saka sana sumunod kayo sa kung anong batas na pinapatupad sa atin to, sa family natin, sa kalusugan natin.
In sickness and in health, this married couple was released from a Mandaluyong hospital after recovering from the coronavirus. And what a beautiful send-off they got from the doctors and nurses who took good care of them. Always confidently beautiful with a heart, 2015 Miss Universe Pia Wurtzbach is doing her share. Wurtzbach donated nearly 17,000 face masks for medical frontliners in Metro Manila.
I want to encourage everyone to do what they can. I mean, a little goes a long way. Kahit maliliit na donations lang yan, when I add it up, I can buy thousands of masks.
The Quezon City District 3 Fire Brigade water salutes our medical frontliners. It's a tradition usually reserved for firemen. A caravan of more than a dozen fire trucks drove around hospitals in Quezon City to applaud the medical workers for their courageous work. They are our brave, modern-day heroes who are risking their lives to save others. I'm Ria Panwat Cotrillo, CNN Philippines.
I'm Dr. Freddie Gomez, and this is The Doctor Is In. You're watching CNN Philippines. We hope that while you're staying safe at home, we can provide you with the medical advice that you need. Our topic for today, COVID-19 and tuberculosis. Cases of TB continue to rise, so let's talk about the prevention and treatment of TB in this time of COVID-19. We are joined by Pulmonary Critical Care Specialist Dr. Jubert Benedicto. Now, Doctor, how is tuberculosis spread, and how can people who are infected with TB prevent spreading it to others?
I think that's a very good question, especially during this time. So basically, as TB is spread through coughing, really cough etiquette, or the way we should be conscious in terms of trying to cover our mouth when we do cough, or when, wag lang basta-basta dudura kung saan-saan. will really help a lot in terms of trying to curb the spread of tuberculosis. On top of that, I think what is more important is to possibly empower the afflicted individual that once he does not feel well, especially during this time, he can easily consult, let's say, even local health centers, not just doctors in the hospital. Barangay health centers are there, and they are perfectly capable of handling TB as well. So basically, it's a health attitude behavior change that we would like to espouse. That basically telling everyone that TB can be treated. TB, we have very effective treatment against tuberculosis. And the best thing is for you to consult earlier on, especially when you are aware of TB symptoms.
I agree with that. I think it is a challenge in how to change the attitude people have towards this disease. And another challenge for TB is that the pandemic interfered with the services for TB treatment. How do we address the concerns of TB patients?
Definitely, that's a huge hurdle for us as far as TB control is concerned. So I'm also a part of the Lung Center Public Health Domiciliary Division, wherein it's basically the TB-related services of Lung Center. And what we did principally for Lung Center is that we tend to be proactive when, let's say, ECQ was declared. We were already anticipating that because of the reduce in terms of mobility of patients, magkakaroon ng problema in terms of them going back to the dot center, and then subsequently, giving them the right medications that they should take, let's say, for that day or for that week. So we tend to be proactive about it. So ang ginawa namin in advance, we were contacting them. We were giving them the medications in terms of their supply, knowing fully well that they will be relatively immobile because of the community quarantine. On top of that, what we did was to engage them in various social media platform. So kinakausap namin, kamusta? May nararamdaman ka ba? May side effect ka bang nararamdaman? Did you take your TB medications for this day? And then subsequently, they were engaging with us. No, na they felt the authentic concern from the TB control services staff, and I think that's a huge plus factor if you are, part of the TB control strategy. Lastly, what we did was to be the one to really take the TB medications in the community. So with our partners from the private sector and from NGOs, we were able to, let's say, give the medications through the community quarantine, through the checkpoints. Kami na mismo yung naghatid sa mga patients. Of course, we endorse certain medications dun mismo sa barangay health worker, sa mga barangay volunteers, or sometimes when we are able to really go through the community, we were the ones who really distributed the medications for our TB patients. Talagang sila na mismo ang tumanggap directly from us.
Now let's take a look at some of the questions sent over the CNN Philippines Facebook page. We have a question from Kate. Can COVID-19 and TB infect a person at the same time?
Definitely, it's possible. So even if we say na both of them bagay yung tinatamaan, yes, they can possibly infect individuals at the same time. We did have certain individuals, let's say, admitted at Philippine General Hospital, primarily because they were COVID positive, but on workup, because we were considering tuberculosis as well, we were able to isolate the TB bacilli sa sputum nila. So definitely both of them can coexist.
Okay. We have another question from Jerlo. How do diseases that weaken the immune system affect the risk of developing TB?
Since TB, ang gustong-gusto ng TB yung as medyo mahina ang immune system. So basically, just remember that once the TB bacilli enters the lung, primarily your immune system kicks in and you call on certain cells of your body to hopefully, limit the infection, if not kill the bacilli together with proper medications. So you can just imagine if you have a weakened immune system, yung cellular capacity mo to protect your body is already a big question mark. And therefore, once the TB bacilli gets in there, yung kanyang multiplication, yung kanyang pag-grow out, let's say sa baga and to possibly reach other organ system is unabated because you don't have, the foot soldiers of your immune system trying to control the TB bacilli. And in this way, the TB disease tends to spread, really tends to, dun siya talaga, gustong-gusto niya yung microenvironment with a weakened immune system.
Okay, thank you very much, Dr. Jubert Benedicto, for joining us and sharing your knowledge with regards to TB and its relation with COVID-19. We have to pause for a break, but just ahead, we'll discuss various efforts to end TB despite this COVID-19 pandemic. Stay tuned, we'll be right back. You're watching The Doctor Is In on CNN Philippines. Welcome to The Doctor Is In. I'm Dr. Freddie Gomez, and we are answering your questions about COVID-19. Addressing tuberculosis cases can be challenging during this time. However, there are efforts being made by different organizations in strengthening TB response amid COVID-19. Joining us is the United States Agency for International Development Chief of Party for TB Platforms Project, Dr. Marianne Calnan. Glad you could join us, Dr. Calnan.
Thank you, Dr. Gomez. I'm happy to be here today.
Now, Dr. Calnan, talk about the TB Platforms Project of USAID. What is it about?
All right. So the USAID has an Office of Health whose main aim is to improve the universal health care for Filipinos in partnership with the Department of Health. So as one of its projects, the TB Platforms, so our full name is TB Platforms for Sustainable Detection, Care and Treatment. One of our main aims is to build the capacity, the capability and the commitment of our regional, provincial and local partners in regions 3, 4A, NCR and in Marawi City to end TB by 2035. The main reason why we support, Region 3, 4A, NCR, and Marawi City is because Region 3, 4A, and NCR are known as a big three because they have about 40% of all TB cases. So that's where most of the TB is concentrated. And our support is to help build the health systems, change behavior patterns for individuals to be able to achieve TB elimination goals. The TB elimination goal is to have one or less people per 100,000 people developing TB each year. Currently, the Philippines has an estimated incidence, so that's the number of new cases of TB at 554 people per 100,000 each year. And so we have quite a bit of work to achieve, elimination of TB in this country.
I think it's great that the program focuses on the areas that are where TB is most prevalent. But how does it address the poor health-seeking behaviors of Filipinos when it comes to TB?
All right. So we have, based on some feedback from the communities as well as previous data that has been collected, like health surveys, TB Platforms developed a communication strategy called Tibaing Dib Dib, which literally means chest strong, but we interpret it as resilience. And using this communication strategy, we interact and engage communities and disseminate awareness messaging through various platforms. For instance, we have what is called the TB Patrol in Marawi City. We have TB contact centers that operate out of facilities. So with the TB contact centers, the patients or people in the community are able to call in and ask more about TB, figure out where they can get treatment from. We also use social media platforms, we use the radio, we use print media, just so that we are able to engage the different audiences. We also have what are called community interactive learning events, and these are usually held during what we call active case finding. So the facility healthcare providers go out into the communities to look for TB patients. At this point, our gratitude goes to the Philippines Information Agency that so graciously has partnered with us to be able to, disseminate all these messages and help improve the awareness of TB, how we can address stigma, where patients can go to, where our community members, rather than patients, where our community members can go and seek services in case they think they have TB.
And how does this program help local government units and the local districts in the response against TB, especially now that services are limited due to COVID-19?
Okay, so prior to the COVID-19, we have what we call a training strategy. So we work with our local partners or the provincial or national, not national, regional or provincial TB coordinators. So we work together with them, building their capacity and capability to deliver the TB services that are required. So making sure that the systems are strong enough or robust enough to ensure that there are drugs available where they're needed, when they're needed. People have access to the diagnostic services that are needed, either by having a diagnostic center or by mechanisms such as sputum transport to take the sputum from, say, a rural health center or a barangay health station to the diagnostic center. We also directly provide, so together with our local partners, we also provide training and mentoring and clinical coaching to build the competency, the capacity of the healthcare providers, both in the facilities and in the communities. So in the communities, I'm talking about the barangay health workers, and we have spent quite a lot of time walking them through our training series that we call Come Alive. So the Come Alive is a set of activities that helps the barangay, that does like a values clarification for the barangay health workers to sort of situate what their knowledge is about TB, how they perceive TB, address any stigmatizing behavior, and it allows them to communicate effectively with members of the community, as well as motivate them to change their behavior, make them have more risk perception for TB, seek out TB services when they think they may have TB or have come in contact with somebody with TB. So that's a lot of our work. The other part of our work is related to building the capacity of the local government units to use data to be able to inform the improvements in service delivery, including resource allocation and funding to be able to deliver those services where they are needed. Another part of our work that we do a lot, especially now with the COVID, is advocacy for LGU commitment to end the TB epidemic in the Philippines, and as well as, bolstering or improving the systems to allow us to implement universal health care using TB as a tracer program, because we know the challenges with implementing UHC. It's a bit complex, but hopefully if we can implement TB service delivery, we hope that would be a model that can be scaled up.
Yes. I'm sure that is very complex, but hoping that all of it will work out as well. Now it's time to answer some social media questions that we have. A lot of people have been sending in questions, and we have one from Menchu. She's asking, if a person is suspected to have TB, can he or she go to the barangay health center for help?
Yes. So as I've mentioned, we've spent a lot of time and effort trying to train the barangay health workers in how to screen and refer patients to facilities. And actually, we are seeing some gains from that. In the last quarter, we noticed that a lot of the patients who are referred or who are diagnosed with TB, a good proportion of them are coming from the community as the source of referral. So, yes, they can. And we would
Okay,
encourage.
unfortunately, that's all the time we have for. But thank you very much, Dr. Calnan, for sharing your time with us today. And we will see you all again tomorrow at 3:30 p.m. only here on The Doctor Is In. I'm Dr. Freddie Gomez. Take care, everyone.